Good morning, everyone, and welcome to Spiritual Health Awareness Week 2024. My name is Trevor Donor, and I'm a MSW, Masters of Social Work student at the University of Manitoba. I'm doing my practicum placement with the Catholic Health Association of Manitoba, Interfaith Healthcare Association of Manitoba, and the Manitoba Association for Residential Care and Community Homes for Everyone. Uh, this is Spiritual Health Awareness Week, running from October 20th to the 26th of 2024. We want to thank you for joining us as we acknowledge the profound impact of spiritual care and psycho-spiritual therapy on individuals, families, and communities. It's our hope that you will help us advocate for improved access to this vital care for everyone. What is Spiritual Health Awareness Week? Well, it's an opportunity to celebrate spiritual care practitioners and psycho-spiritual therapists for all they do, including their unrelenting and essential commitment to the well-being of others, and to encourage a dialogue to talk to each other about why spiritual care and psycho-spiritual therapy matter. So for this year, our campaign theme is breaking the myths of spiritual care and psycho-spiritual therapy. Because despite its extensive and vital role across diverse professional settings, spiritual care is one of the most misunderstood professions in Canadian society, and many of our members encounter misconceptions and false assumptions regarding their work. So this year, our goal is to educate communities about our profession by breaking the myths surrounding spiritual care. So, welcome to day 2 of our webinar series. Today is spiritual care in healthcare, an essential but overlooked practice. We're going to be discussing the role of spiritual care in healthcare settings and why it is often undervalued. We want to engage with healthcare professionals and spiritual care providers to highlight its importance in patient care and recovery. So, today I'm joined by Chenene Layne. Chenene is the professional lead for spiritual health in the WRHA. She also works as the coordinator of spiritual care education at St. Boniface Hospital and is a certified spiritual care supervisor educator with the Canadian Association for Spiritual Care. Welcome, Chenene.
Thank you. It's nice to be here.
We'll be discussing the role of spiritual care in healthcare settings and why it's often undervalued. Chenene, one common myth surrounding spiritual care and psychospiritual therapy is that it's not based on evidence or professional practice. Do you think that perception may be a reason that the field is often excluded or undervalued as part of a multidisciplinary approach?
Well, Trevor, I think this is kind of a multifaceted question. So I know that there isn't a lot of evidence that sort of kind of qualitative evidence on the benefits of spiritual care and psychospiritual therapy. There is some, but especially within Canada, we're really trying to work on getting some more of that evidence out there. And I think that, I mean, in a world where like evidence and stats and facts matter, it is helpful to have those stats to say, spiritual health interventions can do X, Y, and Z and have like quantifiable data that's showing. And so I think not having some of that data can be helpful or harmful for us, um, as it's hard to back up what we know is happening with actual data and stats. So it's
Mhm.
something that we're definitely trying to look at across the discipline nationally as well as kind of internationally. But I think that that perception is sometimes there because it's hard to quantify sometimes the internal changes that are happening to people, or how their resiliency is working for them in a difficult time. And so to not have some of the same data that maybe some of our other interdisciplinary professionals have can be a hindrance sometimes, or can make it seem like we just come in and talk with people and make them feel nice.
Mm,
Whereas we can show that, there can be outcomes that happen when you attend to one's spiritual health, especially in times of crisis.
mm, interesting. Thank you. So, in these days of government austerity and cuts, some people may not view spiritual care as a critical element of care. And how do you respond to those who do not consider spiritual care to be an essential part of healthcare?
I would think, like, most important, I try to respond with education just to back up what it is that we do. And I found that in times when we are able to explain it either to other staff, the general public, senior leadership, etc., it's really helpful when we can actually outline this is what we do and this is how it fits into care. I think it's easy to forget sometimes when we are in a hospital setting or a healthcare setting, and there's physical ailments or
Hmm.
mental illness that's happening, that we have other assets and facets to who we are as a person. And spirituality is a huge aspect of who we are, and it can affect a lot of what we do. And so when someone's sort of beliefs and meaning and purpose and things that help them and give them strength are not necessarily being attended to
Hmm.
while the focus is on other aspects of their medical care, then those things still affect them and can affect how it works. And so when we think about sometimes flow or how to help people move through the hospital, it's important, I think, to think about like what are some of the other things that could be affecting their recovering process or the whatever journey path they're on. And so if you think, they could be stressing out about some aspect, or there could be a loss that happened in their family that we may not know about, but that's what's occupying kind of their mind and their energy, then of
Hmm.
course it makes sense if they're not necessarily as focused on maybe treatments or certain aspects because they're dealing with something else. And so when we miss that part or we don't consider that to be essential, then we are really kind of blocking off an important and essential part of who a person is, and potentially blocking efforts for them to kind of have that whole person recovery because you can't have the
Hmm.
whole person unless you're attending to all aspects of the person.
Hmm. And do you think that that harkens back to the it not being perhaps perceived as being as evidence-based, that's why it's more easily discounted, um, because that data isn't there?
Yeah, so it's harder to quantify or to say, it's not harder to, I guess, in a sense, is that we haven't done it. It's hard to say, I go into
Hmm.
a room, I have this conversation with a patient, we talk about X, Y, and Z, and then the patient is better able to deal with grief or their loss or this crisis in their life, and that has is what has helping them to kind of
Hmm.
move through their recovery process. That's a
Hmm.
lot harder to do as a stat because it's not
Yeah.
necessarily I gave a Tylenol and now their
Mhm.
headache has gone away. So that
Right.
makes
Or
it harder in that
this
way.
clinical trial was done and it concluded this. But I mean, I thought that there is more evidence coming out about things like the importance of prayer or mindfulness, meditation, all those that are actually part of spirituality, that maybe there is becoming to be more evidence they do actually impact people in a real tangible way.
Yes, and we see throughout there's evidence there to show that like people with like a spiritual background or people that have like certain supports in place tend to like navigate through things a little bit easier or have that sort of support structure, whatever it be, whether it's a supportive community, which is could be religious, it could be not religious, whether it's important beliefs to them, which again could be
Hmm.
religious or not religious. It's
Hmm.
what brings people meaning and purpose. And so when we're
Hmm.
able to attend to that, the studies that have happened have kind of shown that yes, like you can see kind of better outcomes or maybe slightly shorter stays in hospital, etc. But
Hmm.
because everybody's different, it's hard to
Right.
know that the exact
Yeah.
same thing will help multiple people.
Mm. Yeah. So when don't include spirituality in a person's holistic healthcare plan, what are we losing? What are we missing out on when we don't include that?
I would say that we're really missing out on knowing the person. There's so much to a person, and to understand kind of what they're thinking, what they're believing, what they feel might be changing for them when they make a specific decision about their healthcare can
Hmm.
really impact their whole healthcare plan. So, for example, if we're not aware of why someone is wanting to maybe stop a treatment or not start a treatment, or there's a specific line of things that the medical team feels is really helpful, or someone in their medical plan feels is helpful, but there's a reason behind why they don't want to do it, and sometimes we don't
Mm-hmm.
know, and then it can lead to us thinking the person's misinformed, or they're being quote unquote difficult or challenging. And so then when we can come in and say, oh, you know what, they don't want this treatment because they had a loved one have this treatment and this is what happened to them, so maybe it's just that they need more education around how this situation is different from that, then that can alleviate some of those fears for somebody. Or if it's, they're of a certain tradition or culture or belief system where this is not acceptable, then
Mm-hmm.
that's helpful to know. And so when you don't know kind of who the person is, it's a lot harder to help them navigate through the system and to treat them. I know Dr. Harvey Chadranath has a great question of like, you need to ask a person, what do I need to know about you to give you the best care possible? And so it takes it a step further from the golden rule to kind of the platinum rule is what
Mm-hmm.
it's called. And so we need to know about what is going on for this person. Who are the people around them? Who do they turn to for support? If they don't have people for support, is there a reason why? Was there a break, etc.? And what brings them strength, or what beliefs for them are being challenged in what's happening. I had a patient who was not religious at all, but their belief was kind of the thing: if you exercise and eat right and don't
Mm-hmm.
smoke and don't do those things, you'll live a
Mm-hmm.
long life. And that was a belief system for this person, who then
A
had
practice, a ritual,
exactly, and
mm-hmm.
staying in shape and doing that, but then they found themselves with cancer just shortly before retirement,
Mm-hmm.
and facing death, and their belief system, which wasn't grounded in religion, was shaken to the
Mm-hmm.
core, because it's like, well, look at my friends
Wow.
who aren't
I did
doing
everything
that.
right. I did everything I was supposed to do.
Exactly. And
Mm.
then this didn't happen, and people who are doing things in their opinion that was the wrong way,
Mm-hmm.
are living fine and enjoying retirement. And so recognizing that those are thoughts that people have when they're sitting, in the hospital, or these are things that they're struggling with on top of whether it's pain or illness or loss of limb or loss of whatever.
Mm-hmm.
We need to know those things to really help support them.
Hmm. That, coming from a social work background, that really resonates with me because that is something that we talk a lot about in social work as well. It's trust and relationship building with folks. And it sounds like maybe, spiritual care practitioners, really do zero in and focus on that trust, understanding the person, and relationship building with them, which could then, help them navigate the healthcare system as well, is what you seem to be saying.
Hmm. Hmm.
Yeah. And you said the platinum rule as opposed to the golden rule. What's that?
So that's that. What do I need to know? So rather than the golden rule, do to others what you would want done to you, it's kind of, what do I need to know about you to offer you
Okay.
the best care? Because what I would want done to me is not necessarily what someone else would want done to
Okay.
them.
So respecting the individual, not assuming that um, what that person wants.
Right. Yes.
Yeah, that's wonderful. So, what role do you see for spiritual care as part of an integrated health approach? In what ways do you see it contributing to the well-being of people and communities?
I see spiritual care and spiritual health as being in there and kind of being that voice for the patients and or families, um, in a time when they're really going through things that aren't the norm, right?
Mm-hmm.
It's not everybody goes through hospital experiences. Not everyone knows how to navigate healthcare or moving to long-term care, et cetera. And so
Mm-hmm.
kind of being a voice for that, and sometimes highlighting that as part of the healthcare team and saying, this is a struggle for this person for this reason. And having been in, healthcare scenarios where the team is kind of wondering, oh, why is this not happening, or why is this? And then you can go in and talk to that patient, and the patient saying this, and this. And you can come back to the team and say, it's not because they don't want blah, blah, blah. It's just
Mm-hmm.
because this is going on right now, or they're not in denial of their prognosis or the seriousness of their condition. It's that they have a grandchild's wedding that they really
Mm-hmm.
want to make it to, and they don't want to be groggy from the medications when they're going to the wedding. And so sometimes just bringing that stuff back in perspective then helps to either say, okay, maybe we can try a different medication, or okay, maybe we can look at delaying this, or no, we really can't delay this. So we need to talk to the person to figure out what's the best thing we can do. And so I think sometimes it's bringing that humanity back to the forefront when it can get really easy for all of us to kind of go into, this is the problem, how do we fix it? And this is to
Mm-hmm.
remind that, like, there's a multifaceted aspect of what is happening.
Mm-hmm.
And then on the flip side, like helping people recognize their own inner strength and resources, I think would help just the well-being of people and communities in general, because they're realizing, hey, I made it through this really tough thing and I could probably do it again. And to be able to have
Mm.
that time to reflect and really spend time thinking about like who they are, what's important to them, etc. Trying to sometimes bring reconciliation to families or friends, or
Ah,
repair relationships that might have been damaged. Um, Supporting staff is another huge part of what we do, and knowing that, yeah,
really?
in healthcare can be really stressful. So some of our mandate is to support staff as well with either, frustrations they may be having on the job, but also staff are dealing with things from home as well. It's not easy to always just shut off the rest of our lives just to come into work mode. And so to be there to help people as they're supporting their own loved ones in the real world and coming into the hospital and having to do this sort of work day to day.
Huh, I never thought about that. But wow, that is an incredibly, I mean, you hear so much about how overwhelmed, healthcare workers are. And I never, that never entered my mind that you would also play that role, that spiritual healthcare providers would also play that role helping the staff so that, they're contributing to their best and they're helping, the people that are part of the healthcare system. That's really interesting.
So we kind of have it within our mandate to support staff as well. And so it's patients, families, and staff.
Really?
And how can we kind of keep, yeah, that spiritual health side of things for people, help support their spiritual health in what they do, regardless of kind of what position they're in here in healthcare.
Hmm, that's wonderful. That your answer kind of made me think back to like the first question we talked about, where like, so many of the healthcare uh practitioners are evidence-based, and it seems like a lot of it can be overwhelming and very system-centered, and you're bringing what spiritual care providers do is bring it back to the person and advocate for them and help the person that's within this giant system that maybe is focused on fixing people and solutions, and you're bringing it back to the person.
hmm
Yeah.
Yeah,
Mm.
and helping to raise that awareness that, yeah, the person is who we're treating, so we need to know the person.
You need to know the person.
Yeah,
Yeah.
and the
And that could
person is
get
doing the
lost.
treating. Exactly.
And
Yeah.
that could get lost without the spiritual care provide. So in your mind, what do you think it would take to change the attitudes towards spiritual care in healthcare settings?
I would say I think it's a bit of, for me personally, what I have seen would be, it takes experiences. So there's so many people that, especially if you're going kind of just to see patients and check in, or see residents and check in, and like, what is spiritual health? What is spiritual
Hmm.
care? And then you meet with them and you talk, and they're like, thank you so much, or I haven't been able to share some of this stuff before. And so it's, a lot of it is in the relationships that we build, even with staff. If you go on a unit and you've been asked to see a patient or resident, and you go and you see them, and then the staff see a positive benefit or outcome to that situation, then
Hmm.
they're like, hey, let me do
Right.
this again the next time I see a similar situation. So a lot of it, I think, has to do with the relationships that we build, the work that we do, and demonstrating that, and then having that kind of recognized across the board. So things like this, like Spiritual Health Awareness Week, where we can actually speak freely to what it is that we're doing, and to kind of open up, because almost every time I have a conversation about spiritual health, someone's like, I didn't know that's what you did. And so
Mm.
those sorts of opportunities where we get to share these stories or share the work that we're doing is really helpful. And to get some of this stuff moving up the chains to this, senior leadership, government officials, et cetera, out in the public so that people know that this is a resource. This is an aspect of healthcare that is not only just important, it's available to them, and that it is important to nurture our spiritual selves because that makes up a huge part of who we are.
Mm. Yeah, I mean, just in our short conversation today, I've learned so much myself and learned so much about the benefits of spiritual care and the different ways that you contribute, helping people navigate systems, helping to advocate for people, helping to, be able to speak on behalf of the person, reconciling with, helping families to reconcile, helping people to process. Then you also brought in the piece about helping, you know, um, you know, overwhelm staff teams and staff members. Um, you know, it sounds to me like it is an essential part of healthcare, spiritual care. And I want to thank you because
Mhm.
I've learned so much myself today just in our brief chat.
Thank you. I love talking about it and I love kind of, yeah, getting that awareness out because I, as you can see, I truly think it's very
Hmm.
valuable and I'm very passionate about it. And so I love being able to speak about some of the realities of what this is and how it can be a benefit to everyone.
Well, thank you very much for taking the time to talk with us today.
Thank you.
Um, and I hope you have a great week. And I hope folks tune in for more conversations that we'll be having as part of Spiritual uh, Awareness Week. Okay,
Thank
thank
you
you
so
very
much.
much. Okay,
Thanks. Bye-bye.
bye bye. Okay, thank you very much.
I was like, I don't know if I'm supposed to actually leave. Okay, I can leave now.
Now we can leave. Now we
Now we
can
can
leave.
leave.
Yeah.
Okay. Thank you. This was
Okay.
fun.
Okay, I'm glad you enjoyed it. Thank you for talking to me. I really did appreciate it very much.
Thanks. Have
I
a
didn't
good
know
one.
how much I should jump in and ask like questions that I hadn't written down, but they were like I legitimately did like, oh, that's that was
Yeah, no, I loved it. It made it feel a lot more just kind of conversational too, so that was great.
good. Okay, thanks, Shanine. Good
Have a
luck.
great rest of your day.
Congratulations.
Thank you.
Okay, bye.
Bye.